Today's Cardinal lesson, the 7 Medicare mistakes. So what we're doing is we have 6,000 customers that have Medicare insurance with us, and lots and lots of people and lots of experience. And I'm not just talking about the people that are just coming in the door and meeting us for the first time. I'm talking about people that have been on Medicare for 5-10 years. And what you're going to get out of this video is what we've determined the 7 mistake areas, or the 7 items that you need to learn about before you even start with Medicare. And if you've already started with Medicare, you need to do some remedial learning here and get boned up on these subjects, or you can kind of call us. So, Tom, why are we doing this video today?
Yeah, I mean, we're doing this video because Medicare is confusing. And it just is. And if the decisions you make now are going to live with you the rest of your life on Medicare. And so you need to understand how to do this and really avoid some of these common mistakes we're going to go over today. Because at the end of the day, some of these are costly, some of them are irreversible. You can't change them, you can't fix them. And so it's better to learn of them now before you start doing stuff and end up in a bad spot. So again, we just want to walk you through the 7 areas where we commonly see people miss things, make mistakes, just to try to help you prevent from doing that. So let me bring up the show notes. You can find these below our video. They're also on our website at cardinalguide.com. We have the board that has those 7 listed out here. We'll walk through each one of these in a second. And then we have the Medicare and You book. I'm not going to scroll through every page. It's 100 something pages long. If you're on Medicare, they send you a copy of this. I caution you to read through all of it. Everything we're going to go over is going to be supportive what's in this book. But if you start from cover to cover and read through this thing before you watch the video, you're going to walk away more confused than you started. So listen to the video first. We'll sort of explain it in sort of terms that are understandable. Go back and reference a book if you want to, but again, they don't make it easy to read through this and understand kind of what it is you're doing here. So let me turn it back to Hans. We're going to go one by one and just walk you through, introduce these 7 areas that are, again, commonly mistakes we see made.
Okay, number 1 here, original Medicare versus Medicare Advantage. And if I asked you right now, could you tell me the difference between the two? And I'm betting a lot of you would give it a shot, but many of you really wouldn't be able to come up with the correct answer. And so this is numero uno. This is, if you're going to go on Medicare, or you already signed up and you've been there for a year or two. Our producer, back a few years ago, he was in that situation. He had already been on Medicare for a couple of years, and we started asking him, so are you on a Medicare Advantage or are you on original Medicare? He took a shot at it and he told us it was Medicare Advantage. We had him get out his wallet real time, pull out his Medicare card, and then pull out his insurance card. And then he read to us what was on the card, and we were able to place him here. His attention span went way up on the difference between original Medicare and having a Medicare Advantage. So I just can't stress this enough. And what I'm going to tell you is the original part, we could just cross that out and we could say Medicare, and we could cross out the Advantage part, and then it would be Medicare versus Medicare. So original Medicare, they didn't call it then, came out in 1965. Lyndon Johnson signed it into law, and it's been around ever since. And it was really unchanged, and it's not changed that much here in 2026. I mean, it's got Part A, it's got Part B. You file your claims with the government. It's got deductibles and co-payments. I mean, it's changed in terms of the size of the deductibles and co-payments and a bunch of stuff around. But original Medicare is just, they didn't start calling it original Medicare until they came out with Medicare Advantage. And that was along about 2005, 2006. And what it is Medicare Advantage is the privatization of Medicare. And so you have to get on original Medicare first. You sign up for that. And once you're signed up on that, by choice, you privatize your Medicare. You go to an insurance company like United Healthcare or Humana or Blue Cross or somebody, that offers a Medicare Advantage plan, and you turn your original Medicare into a Medicare Advantage. And so I'm not going to get into a lot of the details of that. Is you need to know the difference between the two, specifically which one you're on and what your options would be to go back. Tom?
Yeah, I mean, I think this is again one of the most common mistakes we see. And if I just talk to somebody for a couple of minutes and they start telling me what they have on Medicare, it becomes pretty evident to me that they don't know what they have, right? They're attributing some things that are Medicare Advantage to the Medicare Supplement. They're doing Medicare Supplement, applying it to Medicare Advantage. There's different rules, they work differently. We have other videos on that. So today's video isn't necessarily getting into the differences there, but you need to know what you have because the rules are different, right? There's just different things you have to focus on, different things you need to worry about when you have one versus the other. So if you don't know definitively which one you have, I want you to do a little bit of research, go back and watch some of our videos, figure out which one you have first, and then we can talk about sort of are there things that we need to adjust, change, or move around there. So again, you need to know where you're at in terms of that. If you're just signing up now, you need to understand the differences. That's going to help you pick which direction you want to go here because it's an either or decision. You can't have both. You either have one or you have the other. So you need to know the differences there. Number two on the board is penalties. I can't tell you the number of times people have come into me. They're turning 65, or maybe they're turning 65 in a couple months. I will let you know when you about 6 months ahead of time before turning 65, you're going to get a lot of mail. You're going to start getting a lot of mail talking about, oh, you're signing up, you're about to turn 65, you need to sign up for Medicare. If you don't sign up, be aware there's penalties, lifetime penalties. You'll see that written everywhere on the stuff that you get, which is true for certain people, right? That is, those penalties exist and then they're real. So you need to pay attention to them. But some people come in just terrified of these, right? They don't want these penalties. They think it's the worst thing in the world, which again, we want to avoid the penalties for sure. But they miss the critical piece that they're still working. They have health insurance through a job that they're still working at. They don't have to sign up for Medicare. They can delay Part B of Medicare, avoid the penalties, even though all the letters say you're going to have these lifetime penalties. If you meet certain circumstances, you can delay that. Now, on the flip side, I see a lot of people who just sleep through Medicare, right? Maybe they're working or maybe they're self employed. These are the real bad ones. They're self employed, they have a small business, their group coverage does not count as credible coverage for Medicare purposes, and they don't sign up. Now they are facing lifetime penalties that, again, they're going to stick with them the rest of their time on Medicare. So, again, today's video isn't getting into all the penalties, how they work. We have other videos on that. But some people need to be concerned about them. Some people don't need to be concerned about them. You need to know how they work. Because at the end of the day, if you have a penalty, if you get assessed a penalty, it means you made a mistake or you missed something. And a lot of those penalties are there for the rest of your life. You can't get rid of them. You can't undo them. You're stuck with them. So again, you need to know how they work and how to avoid them. Hans?
Yeah. I mean, your lack of knowledge of how these works and how they can happen is the problem. First is when you're coming on to Medicare and you're terrified of penalties, because you don't understand them, and you could make a wrong move, which is signing up too early, trying to avoid penalties. And then on the flip side is if you just ignore penalties and it's all about sign up periods and timing of sign up. Just like Tom said, that self-employed, we have lots of those that they came to us at about 67 or 68. They thought that their group insurance or their COBRA or something got them out of having to sign up at 65, and they just ignored it. And then all of a sudden now they've sold their business, they've retired, they've gotten sick, and now they want to sign up for Medicare because their insurance is ending. And not only are they going to have to pay a penalty, but they're going to face a sign-up period. So this is something you need to learn about. Okay, number three, IRMAA, the Medicare tax after the fact. I mean, IRMAA, once you're aware of it and then you work to understand it, it isn't that hard to get a grasp on. Is if you had a lot of income 2 years ago, a high taxable income, or what the government calls a high taxable income, you're going to pay extra, maybe a lot extra, for your Medicare, and it's called IRMAA. The problem here is about learning about it after the fact. Okay, we signed up for Medicare, and then we got this letter, and then in this letter, it says to me, that here it lays out IRMAA. If you just read that letter and understand that letter, you know what it is. But the real problem in the letter, if you just got one recently, is they're using your 2024 tax return. And that's the piece that really gets people, because it's like, in 2024, I had this amount of tax or this amount of income, and now you're charging my Medicare in 2026. And I can do nothing now that I've learned about it. I can do nothing about my 2024 tax return. And people feel, very upset. Tom?
Yeah, I mean, I think this IRMAA, if you're finding about it the first time is you're getting a letter that's telling you have to pay it, it's too late, right? I mean, you have done something 2 years ago that you can't undo. Like Hans mentioned, you can't go back unless there was a mistake on the tax return. Generally, you can't go back and refile your tax return, right? That's not how that works. And so, our goal is to at least teach you about it. Now, we have other people come in that are like they've learned about it, and now it's this thing that they should avoid at all costs. No matter what, I don't want to pay anything. And then they make bad decisions there. So IRMAA is not like this evil thing that we should avoid at all costs, right? Sometimes it makes sense to pay some of it. The biggest thing is I just want you going in, knowing what it is, how it works. And if you're going to pay it, at least understand that the decisions you're making today will have you paying a little bit more for Medicare 2 years from now. So just go in with sort of your eyes wide open, understanding how it works and when it makes sense to pay it, when you should try to avoid it, and how that works there. Some of the things I'll just give you a couple examples where I see people make that come in really probably the most upset about this that I see are the ones that don't consider themselves high earners, and maybe objectively they're not, but they start doing things with their retirement accounts. I've seen people cash it out to buy a second home, right? So they just cash out their whole IRA, 401k, pay a bunch of taxes to do it, to go buy a second home, and that throws them way up into the IRMAA levels, right? And they're like, "Well, I didn't know this was happening." I've seen people who, you know, sell a second home, and maybe that's the right thing to do, but they don't know the impact of that's going to have on their Medicare stuff. So you just need to be thoughtful when you're in generating income, taxable income on your tax return, what impact that has 2 years from now on IRMAA there. Number four is Medicare does not pay for long-term care insurance, right? So this is a common, in the planning we're doing, the financial planning, we're often bringing up the topic of long-term care. Do you have a plan for that? And a very common comment that we get back is, "Oh, I thought Medicare was going to pay for that." And newsflash, it just doesn't, right? I mean, it pays for very limited amounts after an acute event. So if you had a hospitalization and you went into like a skilled nursing facility, like under a rehab type situation, it might pay for 30, 60, up to 90 days. But after that, you're on your own. And that's only for rehab, right? That's not sort of custodial long term type care. And so you need to have a plan in place for that. Insurance is available if you can qualify. The plan doesn't always need to entail insurance, right? Maybe you just have a written plan of how you're going to pay for it if this happens, right? But the risk of long term care is one of the biggest risks you're going to face in retirement, and Medicare is only going to do very minimal amounts to help cover that risk. So you need to have a plan in place for that and not rely on Medicare to cover that risk. Hans?
Yeah, Medicare is going to pay for skilled nursing care in a limited amount for a limited time. They're going to pay nothing for custodial care, and they're going to pay nothing after a maximum of 100 days. So this is something many people, I have people 75 years old, been on Medicare 10 years, and they say, "Oh, I thought Medicare covered that." It doesn't. Okay. Medicare 10 standardized Medicare supplement policies. And, it's just, quote, Medicare 10. That's a 1992 term. That's when the government, by proclamation, standardized all the Medicare supplement policies. So, yeah, and this is news to a lot of people on Medicare, is that there are 10 Medicare supplement policies available to you, and they named them A, B, C, D, and so on and so forth. And then, so you need to learn what they are, and just the fact that there's 10 different ones, and those 10 different policies are exactly the same company to company. So then when you narrow it down, and a lot of people narrow it down, they say, well, I'm going to buy a G plan, or I'm going to buy an N plan, or I'm going to buy a high deductible G. I mean, one of those 10 plans, that's fine. But what a lot of people don't understand is the standardized piece of it. So if you bought Company A, and Company A is charging you for your Plan G $200 a month, you bought it a few years ago, and there's another Company D over here, and Company D charges $140 a month for exactly the same thing. You need to know that, okay? And it's just, so the purpose today is not to teach you all the differences. We just want to make you aware that Medicare supplement policies are standardized. They're exactly the same from company to company, but the place that is different from company to company is they can all charge different prices. Tom?
Yeah, I mean, I think this is a critical thing to know, especially if you've been on Medicare for a couple of years, right? A lot of people feel like I signed up, I did all the research when I turned 65, I signed up for my supplement, and now I'm good. Which often is not the best way to do it, right? You need to shop these plans around every couple of years because these prices go up, right? These companies raise their premiums, other companies come in with lower costs, assuming you can qualify. It makes sense to shop these around, and having them be standardized makes it fairly easy to shop, right? If I have a G plan now and I'm moving to another G plan with another company and it's charging less, I'm getting the exact same coverage for less money, right? It's almost a no-brainer, right? Assuming the savings are enough. So again, we can help do that. We have other videos on how to do that, but you need to understand that, and this is specific to Medicare supplements. Medicare Advantage plans, those are not standardized. Those plans differ pretty drastically from plan to plan. So you do need to get into the benefit comparison on those plans. But on the supplement specifically, a G plan is a G plan, an N plan is an N plan. Does not matter what company it is, the coverage is identical. So you just need to understand that. Next on the list is this Medicare and the coinsurance limit. So sometimes you run into people that have signed up for Medicare. They're like, I don't want to deal with the secondary insurance. Medicare is good enough. It covers a portion like I'm used to with the group, and I pay my 20%. So most people have heard this before. Medicare Part B will pay 80% of the cost, and you're paying 20%. That doesn't sound that bad, right? A lot of your group coverage through your work right now works the same way. They pay 80%, I pay 20%. The biggest difference, and this is where we need you to understand this, is Medicare does not have a maximum out of pocket. So your current plan, if you have group coverage, there is a limit to how much you're going to pay in a year. Now, sometimes it could be pretty high, right? So I'm not saying it's a great number, but there's at least a number that you can't go above. At that point, the plan pays 100% of everything. Medicare does not have a cap. So if you have 20% coinsurance and your bill is $100,000, which is not unheard of by any means, you are going to be stuck paying $20,000, 20% of 100,000. If the bill is 200,000, that's 40,000 coming to you. So there is no limit to how much you can pay, which is why you need to have some type of secondary insurance, whether that's a Medicare supplement or a Medicare Advantage plan. Again, we can get into the differences later, but you need to have something that limits your exposure to an unlimited amount of out-of-pocket costs, which is what original Medicare by itself, that's what you're signing up for, is an unlimited liability, an unknown number. 20% of whatever the bill is could be quite a lot. Hans?
Okay. So it's kind of interesting because while I'm listening to you, Tom, on number 6, I'm hearing you say that Medicare, and I wrote it on the board, has a no co-insurance limit, where I'm implying that. And, the thing is, what I'm talking about is original Medicare has no co-insurance limit. Actually, Medicare Advantage does have a maximum out of pocket. Okay. But now we're over on Medicare Advantage. I had a guy write to me in a comment on a previous video where I was talking about this thing. And he says, oh, you're wrong. He said, my Medicare Advantage plan, or my Medicare plan, as he called it, has a $3,000 out of pocket or a $10,000 out of pocket. You're wrong. And I'm just saying, okay, you tell me I'm wrong, but we were talking about original Medicare and Medicare supplement. So I want to make that point, is this is about original Medicare. The second point I want to make is that your Medicare supplement policy is going to fill that 20% at some level, depending on which one you buy, and it's going to have an unlimited benefit. So, we're bringing up. I just for this, I want you to understand what we're talking about. Yeah, and this video is not going to clarify that. We're just trying to go over the 7 biggest areas that people are confused or misinformed about. So that's the Medicare coinsurance limit. Then really number 7, and the last one, is that original Medicare has no networks and no managed care. Okay. And I'm telling you, the people that work in doctors' offices are the ones a lot of times that are confused about this, because they deal with so much Medicare Advantage. So they want to know if you're on Medicare and then who your provider is. Who do you have? United Healthcare? Do you have Humana? Do you have Cigna? I mean, who do you have? Because the doctor's office that you're going to, they want to know if you're in their network, or they want to know if they, take your plan. And you want to know that too, because you're picking your doctor according to the network. That's on Medicare Advantage. When you're on original Medicare and presumably a supplement in addition, you do not have a network. You can go to any doctor in the United States that takes Medicare and accepts Medicare. You're in. You don't even have, you got to show it to them. And where they get confused is sometimes you have your Medicare supplement with the name of the same company with a Medicare Advantage plan, or many times they're just some name they've never heard of, and they say, oh, we don't take that. And so that's where we come in and, straighten them out, because they do take original Medicare, but they don't take the supplement. Well, that's an impossibility. Is if you take original Medicare, you'll take the supplement. And then the no managed care, that's huge, because if there's an area of dissatisfaction with Medicare Advantage is that I needed some care, my doctor was recommending something, that I'm going to go have a type of surgery or some procedure or a test, and then I got to get the approval of the Medicare Advantage plan before I can go forward with the test. Okay. If you talk about something that gets people hot, this is it. Okay. And it's all the procedure they go to, especially when they get turned down. With original Medicare, you don't have any managed care, because your supplement is just secondary. It's coming in and filling in the gaps of original Medicare, which does not have a network and it doesn't have managed care. Tom?
Yeah, I mean, I think it is a common call we get. The client is somewhat in a panic, right? I just went to my doctor and they told me they don't take my plan anymore. Now, if you're on a Medicare Advantage plan, that could be true, right? I mean, that happens for sure, and that's one of the downsides to Medicare Advantage plans. And the networks can change from year to year, right? So that's also another thing you got to keep an eye on if you're on the Medicare Advantage plan. If you're on a Medicare supplement, I don't care what your doctor office said. A lot of times they don't understand is if they take Medicare. Now, some doctors don't take Medicare. Now, if they don't take Medicare, the supplement's not going to work either. But assuming they take Medicare, which again, most do, they have to take the supplement. They don't get an option. They can't say no. And so, and again, the front desk people, the doctor's office, they're trying to help, right? They're trying to make sure you don't get coverage if you don't, or get cared for if you don't have coverage there. So I'm not faulting them. They just don't understand, right? And so if you have Medicare, if you have a Medicare supplement and the doctor's office takes Medicare, you can be seen. You don't have to worry about networks. You don't have to worry about referrals. You're going to get coverage there. Even if the front desk lady said no, the billing department in the back of the doctor's office, they know how this works, and you can ask them, and they will say no, you're good. But again, that is a common call we get, and it can be concerning, right? You're about to be seen. Your doctor says we can't see you. I understand why it's concerning there, but I'm just telling you, if you have Medicare, you have a Medicare supplement, your doctor office takes Medicare, they will see you. You will have coverage. You don't have to worry about networks at all.
Okay. So if you're getting ready for Medicare and you're studying this stuff, you're just learning, or you're in the middle of that, use this list as the 7 things you need to learn about. And, you need to make a score of 7 or 100%. You need to know the difference between original Medicare and a Medicare Advantage plan. You can find it in this book. You need to know about the enrollment periods and the resulting penalties. You need to know about IRMAA, and you need to check whether you're potentially a high income earner 2 years ago. You need to understand the long-term care coverage within Medicare. You need to know about the 10 standardized plans and look at them on that chart and begin to decide which one you want, as opposed to just having somebody come in and pitch one of them to you and saying, this is best for you. You need to know all about that, and you need to understand that they're the same from company to company. You need to understand that if you stay on original Medicare and you get a supplement, there's no co-insurance limit. And then you need to understand that original Medicare, this is the biggest reason that people pay the money for a supplement. In addition to original Medicare, is they don't they don't want somebody telling them what doctor to go to or what hospital, and then they also don't want the insurance company getting involved in the care decisions. They want to be able to make those between them and their doctor, and they want to keep the insurance company out of it. So you need to understand all that. So there's your list of subjects to study. And so, in terms of comprehensive financial planning, I mean, we go over Medicare with just about everybody we do a financial plan for. In many cases, they buy it from us. So we talked about Social Security because that's where you go to sign up for Medicare. It's obviously this video is about Medicare. We talked a little itsy bit about long-term care, and the rest of the stuff, not so much. Maybe income and taxes, because when it comes in for IRMAA. So I want to bring Tom back on. I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you very much for listening.
Thank you.